Evening to you. This is Dr. Gerald Thompson with Your Health Matters. I was hoping to have had a guest this evening, but happens sometimes with these late events. Some of our guests are unable to make it, or sometimes a little bit of a late notice to them. We're not able to produce them, but put off for another time. But this evening, I want the women who are listeners, I want you to listen to this. I want to talk to you about cervical cancer. Now, everyone knows cancer. And if I were to tell you about cervical cancer, what the hell is that? Where is that? Where is that? A lot of people don't know a lot about cervical cancer. Well, in the women, they have something called a womb. You've heard of the womb? Another name for the womb is the uterus. And we all know if sperm goes up into that womb during sex, and there's an egg that's been released by that female, then that sperm will fertilize that egg. And that egg can grow inside the womb to create a baby. That's the simple version there. But a womb is really an organ inside the female. Let me say the womb is about as big as this, a little bigger than this remote inside the belly. And believe it or not, at the end of the womb is a narrow part, and down here is what we call the cervix. And I should have had a nice picture of this, but the womb sits in your belly on top of the vagina. It's simple like that. And when, thank you very much. Huh? Yes. And when you have a situation whereby there's a baby that's being fertilized, an egg and sperm, that's one issue. The womb itself, the uterus, can have all sorts of different problems. Fibroids. There can be a condition called endometriosis. Oh boy, that causes a lot of pain. But I want to tell you about the tip of the uterus, which is called the cervix. This is the narrow mouth of the womb, the uterus, and it's called the cervix. And I want to tell you that cancers can develop in the cervix and are quite common. Matter of fact, if I want to tell you that in the world, cervical cancer, which is at the tip of the womb, may be either number 2 or number 3 or number 4 most common cancers. Now, I want to start off by telling you that in the United States and Canada, women in those places have cervical cancer too. But what if I told you that cervical cancer in other parts of the world, like the Caribbean, are 6 times more common than that of persons in the United States? And it's not really that they're more common, But people in larger countries are able to detect that cervical cancer long before it becomes a cancer. That's the point. That's the point I'm making. Or they can prevent it from becoming a cancer long before it becomes a cancer. Now, I want to tell you something strange. Have you ever heard of a virus causing cancer? Kamal, have you heard of a virus causing cancer before? Huh? Have you ever heard of that before? Well, cervical cancer in 1983, for the very first time in the history of medicine, it was realized that a virus was causing cervical cancer. A virus was causing cancer. How could that be? How could a virus cause cancer? You know, the flu virus could cause a cold. And you know, a virus could cause chicken pox. A virus could cause herpes. But a virus causing cancer? There's a virus called human papilloma virus. When I was in medical school in the late 80s, I saw patients who had genital warts. See some little growth, black growth growing on the penis or on the vagina. Or sometimes you see these warts growing in the mouth, especially with people who indulge in oral sex. Sometimes you see it in terms of the anus in people who also have anal sex. And then guess what? In the case of females, it was observed that a lot of females who have genital warts, they had a high risk of cervical cancer. That sounds strange, right? Well, let me start all over again. There was a doctor called Zerhausen who first observed this. Zerhausen, a doctor, a research doctor, first observed this in 1983. In 1983, I was in medical school. I just essentially graduated as a doctor, and I started off my residency in internal medicine, my specialty training. In 1987, I would have started my infectious disease specialty training, completed that in 1989. And by 1990, Kamal, we had realized that the research that was available, they got cervical cancer tissue, and they looked at it under special microscope, and they were able to test the cancer cells. And guess what? They found this human papilloma virus, HPV virus DNA inside the cancer cells. How did it get in? How did it get there? Well, human papilloma virus can infect men, boys, can infect girls, and there are many, many, many different strains. Come on. You know? Strain number 1, number 2, number 3, number 4, number 5, go all the way up to strain number 60, within 160. But guess what? They found that strain number 16, strain number 18, and to less extent some others, they were very funny. They tend to get into the cervical cells, the tissue at the tip of the womb, and cause those cells to start to speed up their growth and multiply. Imagine a virus acting like a tape recorder and going on fast forward and making the cells speed up. Imagine that. This was fascinating stuff. And that the virus was getting into the tissue itself and causing the cells of the cervix to speed up. Now, normally, this virus causes warts, genital warts. I used to scrape off genital warts off of male penises. Of course, I had all my gloves, I had all my glasses, I had all my mask. Don't worry. And I used to scrape up genital warts off of female vaginas, in them there on the labia and so forth. I would refer them because if they had warts on their tongue or inside their cheek, I was going to let another specialist deal with that. You understand? And that would have occurred sometimes from oral sex. So the virus wasn't just causing warts in the penis and the vagina, but also causing warts in the tongue and in the mouth and the lips and those sort of things. Very interesting, you know? But we then found out that these viruses could be passed from one person to another just by touching skin to skin, or more so by vaginal sex, or anal sex, or oral sex. Am I allowed to talk this on radio right now? Am I allowed to talk this on radio? Am I going too far? Am I talking too much? Now, listen to this very carefully. In your body, there's what's called an immune system. And if you have sexual contact with someone who has this virus and they pass it on to you, then guess what? You may catch it too. You catch this virus. Sometimes you may not only have one type, number 8, number 32, you can have 2, 3 types of the papilloma virus. And usually within 1 year, within 1 year, your immune system has kicked that virus out, cleared it, gotten rid of it. Isn't that great? Your immune system has cleared your body, cleared your vagina, cleared your penis, cleared your mouth of this virus. Get rid of it. Get out. You may say the immune system should get rid of it in after a day, after a week, or a month, but normally up to a year, it could still persist and your immune system has cleared it in vast majority of people. However, there's some people that the virus may cause a persistent infection. And if it is type number 16 or number 18 type of human papilloma virus, it has a tendency to persist. So you can have sexual contact, unprotected sex with somebody and pick up strain number 24. No big deal. Your body will clear it. You could pick up strain number 52. You could pick up number 24 and 52. Your body will clear it. But if you've picked up strain number 16 and 18, somehow your body doesn't seem to clear it as quick. And if it persists, if it gets a hold, if it gets a hold of you, come on, and persists for more than a year, 2 years, 3 years. Now, you can still clear it after that time, but if it persists for a long time, 10 years or so, then guess what? It can start like the remote control to cause the cervical cells to go on fast speed, on accelerated speed, and they start to multiply. Now, that doesn't mean it's cancer. Doesn't mean it's cancer. If we look at a microscope, we will see some funny changes. And we know that this cell is one that is, fast-tracked. But it's not a cancer yet. And that's a good thing. We can then deal with that. Now, I want to say, if, on the other hand, certain conditions exist, it can make that process go even faster. Let me say, if somebody's HIV positive, if you're HIV, you have a higher risk of it fast tracking to cancer. If you are a smoker or secondhand smoker, you have a fast track. Boy, smoking is being blamed for a lot of things, eh? If you are obese, I'm talking about if you're really overweight and obese, it makes you fast track because obesity affects your immune system. And then guess what? If you were on, they've noticed if you were on birth control pill, imagine that, it also can fast track. And there's certain drugs that they used to give people long ago to stop people from having miscarriages. Some of these drugs, they were stopped in 1971, but they were also found as a side effect to make this virus fast track even faster. Strange, is that right? Now, I'm going to tell you something very important. Cervical cancer. Almost 99.9% of cervical cancers are caused by this virus. 99.9% of these cervical cancers is caused by this virus. And that if this virus, in those cases, it's because that virus has persisted and the virus gets into the tissue of the cervix and makes it go on fast speed. Its growth starts to go on fast speed. Now, having said that, if you are a person who has been getting a pap smear, this is where the doctor has the female and he's able to take the cervix and he uses literally a flat piece of stick, almost like a lollipop stick. Lollipop stick? And he scrapes the cervix. He actually twists it a little bit. I've done many of these. He take away that piece of tissue. He's just scraping it. Just like if somebody's shaving, just like you're shaving, come out, you just take a piece of it and you put it on a glass slide. And we throw some dye over that and we look at it on the microscope. We're able to see, somebody who's trained is able to check those cells to see what they're like. If they're normal, great, wonderful, beautiful, they're normal. But if they start to look funny, there are different stages of funniness. They could look a little bit funny. They could look medium funny. And they could look very funny. They ain't quite cancer yet, but they look funny. When they look a little bit funny, the doctor may say, come back in a short while. You understand? Come back in 6 months. Let's do this over again. Because all this is slow, you know. All this is slow. And listen, the doctor repeats the pap smear. At first, it did look a little bit funny. But now, when you take it 6 months later, guess what? It's looking very funny. Very funny. He will then initiate certain things to be done. Maybe a biopsy or something like that. But if nothing is done, let's say if you don't have no pap smear because you don't believe in pap smear. Let's say you don't have no pap smear because you don't want nobody touch you down there. You understand? You went to that doctor 3 years ago and you didn't like the way she did talk to you. She did look down on you or whatever the case may be, or she was a bit rough on you. Huh? And you ain't going back. You ain't going back, nothing like that. Or if it was done by a nurse or whatever, you ain't bothering with that. Stupid. And they want to make money from you. That's what you say. They want nothing. I hear there's nothing called cervical cancer. It's all a joke. All them doctors just want to make money. And you don't bother. Then I want to tell you that if untreated, and the cells are looking funny between 5 and 20 years, a long time, 5 and 20 years. So short as 5, as much as 20 years, the funny cervical tissues can turn into cancer. When it is turned into cancer, it isn't that the cells are on fast track. They are on a racetrack. They are multiplying so much that they may even start to spread. They may get into your blood and spread all the way up to your brain. They may spread to your muscles. They go to your lungs. They may spread all over the place. They may spread to other tissues, to your bladder. They may spread down your legs to your thigh, all kind of thing like that. You know? They could spread far and wide. They could spread near and far, if I could put it that way. And, you know, you are then in a different category. So, let's start all over again. There are persons who have these risk factors. One risk factor I didn't talk about. If you start to have sex very early in life, you are at a higher risk of cervical cancer. But let me explain that. It isn't so much because if you start having sex early in life, you may then have a partner when you are, I got to say this word, 13, 14 years old. You know, you shouldn't be having sex at that time, you know. And people will say, Dr. Thomas, you should be saying person should not be having sex. You shouldn't even be talking about that. But if they are, and you have it with this boy, and then at 16, you have it with somebody else again, and 19 and 20 and so forth, and you've had 5, 6, 7, 8, 10 partners. Those males, they too could have had 10, 15, 20 partners. And so the different strains, you may well have found yourself exposed to strain number 16 or 18. The bad boys, the ones that really speed up the growth of the cells. What I'm saying to you is that if you just have the virus lurking about and it's not 16 or 18, well, your body might clear, your immune system might clear it. If you have 16 or 18 or 16 and 18, you may not clear it. You may clear it still, but it may persist. And then, if it persists, it could cause the cervix to start to speed up. And you could go through a phase where the cervix is looking a little bit funny, moderately funny, or very funny. And if nothing is done, no intervention after that, because you didn't know, or because you knew but you ignored it, or you moved away, you left and went to Canada, left and went to Barbados or Trinidad, and no doctor there that you know, you ain't got the money to spend on that, then hear what? 5 to 20 years, that funny looking cell, very funny looking cell, could transform into cancer. And when it does that, it's a totally different kettle of fish. Now, what are the symptoms of somebody? Guess what? If you just started having bleeding, now, women, you see your periods, but if you start seeing bleeding, or suppose you've gone through menopause and you stop seeing your periods, but you just start bleeding again. Just funny, just start bleeding again. That's unusual. How comes period come but bleeding come back, but it's bleeding all the time? That's not a good sign. If you have sex and the male is noting a little blood on their penis, or you bleed afterwards, that's a sign. If you start having pain in your back or pain in your pelvis, right? Or maybe your legs start getting swollen, or you're getting fatigued, those things are some indication that maybe that cancer has already started. You're not at a stage of just funny cells. You may have gone very far already. And we may then be at a stage that you may need surgery, radiation, chemotherapy, or even some special targeted therapy that they've now come up with for cervical cancer. Ladies and gentlemen, I want to take a break. And we come back, I want to dig a little deeper into this, and we'll see a little bit more about this.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Now, let me tell you something. This human papilloma virus is common. It's prevalent. Most people have it, but it doesn't mean you have number 16 or 18. And young kids, girls, by the time girls are 15, 16, 17, they may have picked it up. They may have picked it up for various means. Once again, if they've started sexual contact very early. And so there are millions of new infections every year, right? And I'm talking about globally. In the United States, they say it's 1 million infections every year, right? Now, I want to emphasize that there's so many of these human papilloma viruses. And there's so many different strains. But it is this type 16 and 18 that we're worried about. And that I've mentioned 16 and 18, but truthfully, there are others like 33, 34, 35, and more that are high risk but not as bad as 16 and 18. And that they've developed a means by which they could actually prevent 16 and 18 and a couple of the others, 33 and 34, from developing. It's what we call vaccination. But I'm not touching on that yet. The issue is that we've tried for years to encourage women to have pap smears on a regular basis. But somehow this doesn't seem to happen. And strangely enough, it happens in poorer families. Women who go for annual examinations, they will get their breasts checked. They will get their heart checked out. They will get a pap smear ever so often. And the doctor is able to keep track of them. Whereas in other places, they may run out of the sticks to do the test. There may not be somebody to read the pap smear on the glass slides. There's also sometimes some little problems. But the important thing that has to be known is that if the virus is allowed to persist, it will cause the cervical cells to look funny. And if you haven't been checking the pap smears at least every other year, you may be at risk. And I want to encourage women, even if you haven't done it for the last 10 years, I want you to do it. These are times when women, they want to go up to a private doctor, have something more personal. They don't want to go to the clinic, the long waits and so, but they can't go to the private doctor because that's $60, $70, $80, $100 and they want blood tests and so forth. They don't want to have that. It's so important that you check out these regular. And I mentioned to you that it's not just the womb and the cervix you're checking. You also want to get the breast checked. If there's a need for a mammogram, if there's a family history of breast problem, if the breast is looking funny, the nipple is looking funny, the size of the breast has changed, if your husband or boyfriend has noticed some changes in the breast. But going back to the cervix, once again, if you've noticed a little bit of bleeding, on the penis or on the condom that's being used, if you are experiencing any kind of back pain or discomfort or pelvic pain, then this is something that really you need to address. I want to emphasize, cervical cancer is probably the third most common cancer, behind breast cancer and some others. In different parts of the world, lung cancer may be more common, not in St. Vincent. I want to say colon cancer may be more common. But I would say in St. Vincent, cervical cancer may be the second most common cancer. And we need to do something about it. We can do something. And a stitch in time can save 9. I have seen and treated many a woman who themselves had cervical cancer. Wasn't the primary doctor, but for some reason I was involved in these cases. And it is something that is quite serious. Let me say that these viruses, no one ever thought that a virus could cause cancer. And this gentleman, Van Housen, he actually got the Nobel Prize for this discovery in 2008. He eventually got the Nobel Prize for medicine in 2008 for his discovery way back in 1983 in the 1990s. In other words, he didn't get the Nobel Prize straight away. It's when the significance of it and all the proof and so forth, because some people say, no, virus can't cause that. And so, but eventually, all through the 90s and so forth, this is something that we increasingly knew. And it's important that we do not have the tests to check your vaginal secretion, yourself, to see if the virus is there. Some countries are able to do that. We can't do that here, you know? So it's a matter then of doing the pap smear on a regular basis. And having the pap smear read, and I can tell you sometimes mistakes are made. Because send you back the pap smear and say it's normal. But the pap smear was a little funny. So don't let that normal reading go to your head and say, I don't have to check it again. In another 2 years, check it again. This time, it might show that it is the chances of having a false reading twice is low. And so the second time you do it, or maybe the third time you do it, it may start looking funny. But that's enough. You need to know it's funny once. And if you hear or told by the doctor, well, your cells are funny in your cervix, don't get scared. Don't start to scream and think that, well, you're going to die and oh gosh, and so forth. That is what you do. You sober up and you basically do the right things. You're going to follow this through. There's some things that can be done to clean up the cervix and make sure that the cervix tissue doesn't progress into cancer. They could sometimes scrape it. They could even cut off the tip of the thing. And these things work. So by dealing with the problem with the cervix in the pre-cancer stage, before cancer has developed, is best. You don't want to wait until cancer has developed to then start treating it, because then you're going to need potentially surgery, radiation, chemotherapy, and all sorts of other things. All right? I don't know if the line's open. I don't know if persons are going to have any questions. Remember, 457-9997. And it's a unusual topic. Usually people don't ask questions about cancer, about these type of things. You know, as we on radio, persons say, oh, the problem is, Doc, I wish I could call in, but somebody will recognize my voice. You know, if you have a problem, you know, call. And I sent some time ago that I had developed an email that I need to start putting out. The person could send me their questions. I'll respond. From next week, I'm going to do that, you know, so that if you don't want to call because this is a little personal, or this is something that it gets you anxious, and in fact, you even want to turn off the radio because you don't want to hear about it. But it's really important. Now, condom usage doesn't adequately protect you from exposure to human papillomavirus. It helps, but doesn't necessarily adequately, protect you. And sexual activity age, the age of sexual activity is an important determination of the risk. Most cervical cancers, right, are going to occur in persons who have started having sexual contact quite early. And young women age 18 to 30 years of age, they say human papilloma virus infection is most common in sexually active women, young women between the ages of 18 and 30 years old. There is a sharp decrease in the prevalence after age 30. However, cervical cancer is still more common in women older than age 35. Let me say that again. You understand? The virus is most common in women between 18 and 30. After the age of 30, for many women, the immune system starts to clear it up. There's a drop off in the virus being present. But cancer is most common in women over the age of 35, And that is because in some women, the virus hasn't dropped off and disappeared and been cleared. It has persisted. And this persistence can be present for 15, 20, 25, 30 years, in which the virus type may not be one of the real bad boys. Remember I said 16 and 18, but it may be 33 and 34. I mentioned they're half bad, if you understand what I'm saying. But if they're present, they could still cause the progression. They could still start the funniness of the cells. Just like 18. And then I mentioned to you, you can have 16, 18, 33, and 34 all at the same time. When you have one, it tends to dominate, right? But some people can have more than one, There are tests in some places that can be done. If you're listening from the United States, they could do tests to pick up if you have a high-risk human papilloma virus. We don't necessarily have the tests down here. I'm hoping that those kind of tests may be available, But you see, Kamal, when you have those kind of tests, the money that's invested, if the doctors don't write for that, and those tests could spoil, they could just get wasted, It's like food, you and if you decide to do one, the tests are designed, you do 10 tests at the same time. But if you get a request for one, you got to break the packet, and you literally have to waste 9 of them just to do one test. So, if you are, once again, a person who may have a bit of, I was going to say a bit of HIV, but if you have HIV, if you're a smoker, if you've been taking birth control pills, if you have been taking other drugs that, affect your immune system, if you are obese, if you have all these things or some of these things, as I mentioned to you, does cause some progression. Come on, you're not a woman, right? And we have to encourage our women to do more pap smears. Now, it ain't as bad as men who need to do PSA tests. Imagine everybody, there's screening. There are about 4 types of cancer that if we screen for, we could reduce them. Cancer of the brain, there's no screening for that. Cancer of the bone, there's no screening for that. But cancer of the breast, the mammogram, and breast examination, boy, can pick up these things early. Pick up these things early before it's too late. Cervical cancer in the case of the female. In the case of men, it is the prostate, doing a blood test, a simple blood test. And then for both men and women, the colon. We have doctors now out in Georgetown who can do a colonoscopy and check your plumbing. Check your back passage plumbing to see if there's any cancer development. Let me tell you, everybody, if you have a family history of colon cancer, you should be checking these things out. You should be waiting for a doctor. You should be asking the doctor. And it is something that we could do screening for, but pap smears and reduction in cervical cancer really and truly works. There's another method, and ever since COVID, a lot of people have developed their own vaccine anxieties. Your kids go into school, you have to get vaccine for mumps, measles. Even before school, when you're born, you got to get it for polio and those sort of things. And St. Vincent has a high rate. If a young lady is vaccinated for the human papilloma virus by the age of 11, 12, 13, before she is sexually active, it can significantly reduce the risk of her getting cervical cancer. Now, let me say, do you think it is the case if a girl is vaccinated, she will feel, well, boy, since I'm vaccinated, I can go and have sex? No, that doesn't occur. Some people think that's the way their daughter might think, but that's not the case. Do you think that because there might be some skepticism in relation to vaccines in general, what may have happened with the COVID, that person should stay away from all vaccines? Well, that may be your choice. And in the case of mothers and parents, if a child is to receive a vaccine at the age of 13, therefore you are the person who's responsible. You're the one who makes that decision. And you should make that decision. On the other hand, if that child gets a little older and a child is now 19, 20, 21 and already sexually active, they might have already been exposed to these viruses. Were they exposed to number 18? Were they exposed to number 18, 16 or 18? Were they exposed to 33 or 34? Probably not. Maybe not. Maybe. And can their body clear those viruses? Yes. But the thing is, if they have another partner, it could even be their husband, whether the husband is having other extramarital relations, that husband could already be carrying the virus and will expose them to the human papillomavirus. If that husband is seeing other people, may eventually bring that virus home to you as a lady. But the point is that studies have shown that infections with multiple type of HPV can occur. And multiple infections rates up to almost 40% have been seen in some cultures. You understand? And the presence of multiple human papillomavirus genome tends to increase with the severity of the cervical disease. In other words, if a pap smear shows that the virus is looking very funny, don't be surprised if that person has multiple viruses, including number 16 or 18, or both. And multiple viruses usually have at least one type of high risk, and let's say about a quarter of the patients may have a high risk plus a moderate risk with a mild risk with multiple viruses. The majority of multiple infections usually have about 2 viruses at the same time. So it's important to understand this, and I hope that I have simplified it in some way. But cervical cancer is a big jump from having genital warts. And if you find you have these strange little warts or pimples or so, or things like that, then the chances too that you may also have multiple infections. It's good to go and check it out and so on. The bottom line is that this virus was the first virus to be discovered to cause cancer. Since this time, other viruses have been discovered to cause cancer. Do you know that, Kamal? Huh? Huh? Since the time, since the 90s, that we discovered human papillomavirus causes cervical cancer, we found that other viruses cause cancer too. There's some. Have you heard of hepatitis C? And you've heard of hepatitis B? And there are others. Boy, I tell you, the world has been changing, and it is. I thought crossing the road was dangerous, but living in the era of viruses and all kind of stuff, you wonder. I suppose this is why a lot of people suck the teeth and say, "Man, whatever happens, happens." But I don't want you to do that. I believe a stitch in time saves 9. I believe that mothers, you can best protect your daughters, your young daughters, by also having them vaccinated. You as a mother, it's too late for you to get vaccinated. So therefore, you should continue with your pap smears. You want to detect it. Remember I said, women who are 18 to 30 have the highest level of infections with 1, 2, 3 viruses. Right? But the women who will develop cervical cancer are over 35. They're over 40, over 50. I remember all of a sudden, you've gone through menopause and you start to notice a little bit of bleeding again. or you still having sexual contact, and the male, he has a bit of blood on the tip of his penis or on his condom, you know? And these things can be really disconcerting, but the important thing is not to bury yourself in a shell. Kamal, I've met some people who had breast cancer. I'm talking about big breast cancers. Breast cancers about as big as this thing sticking out here. Could feel it. As a matter of fact, the breast cancer has come to the skin and open up like a wound, and they're packing it, but they're hiding it from everybody because they're so scared. There are women who are bleeding. They have cervical cancer, and after a while, the cervical cancer even starts to give a discharge, you know? And they're afraid, they're scared, they don't know what to do. They think something dread is going to happen to them. And they don't realize that something dread will happen to them if they don't do anything fast enough. Stitching time can still save 9. And I want, really honestly, I decided to talk about this today because cervical cancer is probably the second most common cancer in women behind breast cancer. And that we can pick it up. We can pick it up if the cells on the pap smear are looking funny. Whatever the degree of funniness, they're looking funny. And that from there, we can stop this in its tracks. The various obstetricians and gynecologists, they know what to do. And things can be done relatively easily in St. Vincent and the Grenadines now. It's not that expensive. It's not going to break you. It's not going to make you have to mortgage your house in order to live and survive. It's important that you start back having these pap smears. And in the case of your daughters, ones who've never been sexually exposed to this virus from a male, it's good to protect them so that when they are exposed later on in life, right, that they'll be able to resist the high-risk viruses, especially 16 and 18, and some of those bad boys to 33 and 34. And although we don't know here in St. Vincent what viruses you have, a lot of people have them. Men have them, women have them, a lot of sexual contact taking place. And therefore, that's why it's important to get that pap smear done. Go and see your nurse, your doctor, your district clinic doctor. Ladies and gentlemen, it's always a pleasure. I want to bid you a very good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs.